So is everybody here?
Yeah,
We'll
morning.
let people in. Yeah, as
Okay.
people get in, we'll let them in.
All right, good morning. All right, my name is Jim Tolmie. I'm one of the employees here at CACCF. My background is I'm a physician assistant and a certified addiction counselor. Before we go any further, I certainly want to acknowledge the land that the Kitchener area are situated on, and the lands these lands are traditionally used by the Haudenosaunee and the Anishinaabe and neutral people. My apologies for my pronunciation. We also acknowledge the enduring presence and deep traditional knowledge, laws, and philosophies of the Indigenous people with whom we share this land today. We are all treaty people with a responsibility to honor all our relations. So we just thank them. So I wanted to maybe give a little brief history about myself. I'll just take a couple of minutes. As I said, my name's Jim Tolmie. My background is I spent 38 years in the Canadian military in the medical branch. I've been all over Canada in terms of postings from Victoria to even out in Halifax, and spent most of my time in Ontario. And I was fortunate enough to spend 8 years in Europe. I also did a tour in Bosnia, and I also did a pre-deployment training for Afghanistan. I am also a survivor, I guess, if you will, of PTSD. I came back from Bosnia, and being in the medical profession, as we all know, can be quite strenuous. And I didn't realize how hurt I was until a number of years after my return. I'm happy to say that through the incredible psychotherapists that I've utilized, I'm well on my way to recovery. So I just want to acknowledge all of you workers in this field, mental health and addiction, as it is greatly appreciated from a patient perspective. I was saying to the Jen there that I feel more nervous today than I did prior to my deployment to Bosnia. So we're going to start this off. Ben, if you could, the next slide. So what is telemedicine? Telemedicine is the treatment of patients and distribution of health services using telecommunication technology. Now that's whether it's over the phone, internet, Zoom, whatever format that is used. It can include all steps of the medical process from diagnosis to treatment. Next slide. So telemedicine helps reduce barriers to healthcare access. These barriers could include living in remote areas, as we've heard through some of the, the awards last night. It certainly spoke to our northern people living in these remote areas, physical disabilities, and a variety of financial barriers. Telemedicine helps reduce wait times for care, streamlining the healthcare process for both patients and providers. Telemedicine is especially effective for mental health and counseling services. Certainly in the COVID times, I've been working with a number of family physicians in the Kitchener area, and most of the work includes, as many of you may be aware, the telephone conversations, phoning patients and speaking to them about their ongoing or new concern. It's certainly, as I said, effective for mental health and counseling services. Most relevant to our current paradigm, telemedicine allows healthcare providers to see patients while observing physical distancing guidelines. This is vital to reducing the spread of COVID-19 in the healthcare setting. Next slide, Ben. Here at CACCF, we have had a free addiction counseling telemedicine system in place, which allows patients to communicate with counselors in 3 ways. Instant messaging for patients who may need immediate response from a counselor or do not have an audio video capable device. Phone calls, the patient provides a phone number and their availability, then waits for an assigned counselor to call. Video internet call, a call placed using Wi-Fi using CACCF system, which enables the counselor and patient to speak face-to-face. Next slide. How the CACCF intake process works for addiction telemedicine. Okay, so the process is extremely simple. The patient only needs to provide their name, a time zone where they're living, an email address, and create their password. And after doing this, they can select from one of 3 platforms of 3 platforms to connect with a counselor. Next slide. Concurrent and comorbid. Substance use disorder and addictions are often result of or accompanied by other mental or physical disorders. When this occurs, it is referred to a concurrent disorder or a comorbidity. The Alberta Health Services estimates that between 40 and 50% of those with substance use disorders have a concurrent medical or physical disorder, which can exacerbate their condition. Substance use disorders combined with other mental or physical health disorders can create a positive feedback loop, making it impossible to properly address either condition. Next slide, Ben. The continuum of care approach. The solution is both simple and complex. Those suffering from substance use disorder need access to a physician and a counselor. Physicians can provide referrals, prescriptions, and other care that our patients need to manage their concurrent disorders. Unfortunately, finding a physician can be difficult, especially navigating the new paradigm of online healthcare brought on by COVID-19. Furthermore, substance use disorder can act as a barrier to finding quality healthcare providers. Next slide. MIRA Care and CACCF. To facilitate a continuum of care approach to managing substance use disorder, CACCF has entered into a partnership with MIRA Care. Next slide. MIRA Care is an on-demand virtual care clinic with over 90 healthcare professionals, including mental health experts, physicians, pediatricians, cardiologists, etc. Mira Care is 100% OHIP covered. This means Ontario residents can access their services completely free of charge, which is an incredible when you're trying to find somebody that doesn't charge a fee. They have short to no wait times. They are open evenings and weekends and offer same-day appointments. Unlike many other virtual clinics, Mira Care makes every effort to ensure the continuity of care and provide the same healthcare provider across multiple visits. Next slide. Our partnership, this collaboration between CACCF ensures the continuum of care for all Ontario addiction patients. Mira Care will accept referrals from CACCF counselors for primary care. This will enable our patients to receive mental health support, specialist consults, and other healthcare services. Next slide. This partnership, or our partnership, to get together with Mira Care, CACCF counselors can ensure that those with substance use disorders have their healthcare needs met without long wait times or having to travel to a doctor's office. Mira Care offers the same 3 platforms of communication with patients as CACCF does, by instant messaging, phone calls, or video calls. Mira Care is a virtual care provider, but whether you see your clients in person or virtually, you can make referrals to Mira Care excellent healthcare providers. Next slide. So the referral process, and this is really quite simple, and it's even going to become more simple. Currently, the referral process is manual, but it is very simple for counselors to connect their patients with Mira Care. To request an intake form, either you or your patient can email info@CACCF, which can be completed online. CACCF will connect your patient with Mira Care. Again, the partnership going forward. In the future, the intake and referral process will be streamlined. Referrals will be made with a single click. The CACCF and Mira Care platforms will be fully integrated for maximum ease of access for both patients and providers. Next slide. Moving addiction care into the future. Together with Mira Care, we can continue to provide the best possible care to our patients. As the field of patient care continues to evolve, partnerships like these are vital to ensuring that our practices and services continue to stay relevant. All right, so some questions. I saw the questions that were online, and I got some responses. So before we open it up, let me just go through some of them. And I want to certainly welcome all of those from across Canada. I saw Quebec, I saw Saskatchewan, British Columbia. I even saw it down in Florida. Thank you for joining us. And last but not least, I must say Thunder Bay. I see at least 2 that were from Thunder Bay, and I just want to say, if you're ever in the Kitchener area, make sure you bring me up some Persians from Thunder Bay. I miss them dearly. So now there was one question, is there such a system being offered to the rest of Canada? At this point in time, Mira is looking at Ontario. It is their intent to go Canada-wide, and once I finish answering these questions, if you have any further with regards to that, I'm certain Crystal will be able to answer that. And there was another question. It said, in the portal, could we have a communication board to bounce ideas off? And that's a great idea. And I think that came from Tara. And we can set up a separate communication board for counselors. So that's certainly something that that we're able to do, and we're going to look into that. So great idea. And one other question that I saw from Tara was, what about adding a section where we can all help build a comprehensive resource guide? Example, detox centers, CAMH, and the likes. And as we speak, this is in the works. So that was another great idea. So other than that, this was a fairly short presentation, but we're going to open it up. As I said, I have Crystal here with me, so if there's something that I'm not able to do, which is probably likely because I've only been here for the last 4 months, so I'm very grateful for that. And let's open it up. Okay.
It's a silent bunch this morning. They're still.
I know.
Or your presentation was so good, there's no questions.
Wow. Maybe they're all, yes.
I have a question. Would this collaboration with Medicare, would that allow for kind of case conferencing if they're referred to, let's say, a physician or a psychiatrist or any other care provider?
I don't believe so at this point in time, and I don't know if that will. It would be similar to going into your family doctor, and Crystal, correct me if I'm wrong, and seeing your family doctor and getting a referral to a specialist.
Okay.
I would suspect it would be a very similar process.
So they're
Yeah,
coming to
Jim-
CACCF through Medicare, and then we're just referring them to.
So
And
basically the process, the way that it works is when it's like like Jim said, you have this person will have a family doctor. So having our collaboration with Medicare means there's anyone in Ontario who has a primary or secondary diagnosis of addiction will have a family doctor who wants it. There will be no one turned away. The case conference section, this is a new partnership, but we're actually working on having a dedicated physician who can actually do case conferencing, but that's probably still several months away, just because the onboard period has been so fast and furious already. We know that there's thousands and thousands of Ontarians with addiction without a family doctor. So
Yeah.
onboarding has just been incredibly busy. Once all that's kind of starts to settle, we'll start working on the longer term continuum, case conferencing and things like that. So it'll come, but it's going to be a little bit of time still.
Okay, yeah, because I think that's important. If they've developed a relationship with, let's say, myself as an addictions counselor, and I make that referral, or it comes through CACCF, then they're able to access, the care that they need.
Absolutely. And with Medicare, so there's about 130 different specialties that Medicare has. And so even if you refer your patient and within Medicare, they're seeing, say, a cardiologist and a psychiatrist, and because there's also psychiatrists at Medicare, so you can do direct referrals that way as well. So the waiting list for psych will be 0 with Medicare. So people who are stuck in the psychiatry kind of bubble right now of waiting for 9 months for an appointment, that's over. That's done. We fixed that. So, but those people will all case conference weekly. So there's a possibility that we can ask them to sooner pull in our counselor. What's going to happen eventually, you're going to see a lot of changes in September in the province of Ontario specifically, and you'll start to see that the addiction counselors will start to drive the healthcare and drive the file instead of us handing it to, 6 other specialists all over the world. It'll actually be the addiction counselor leading the file with a primary or secondary diagnosis. So there's going to be a lot of changes coming up. This is part of that change, obviously. It's in its early days. It's definitely an infant right now, but we're super excited because from this point forward, there will never be, if they don't want to be without a family doctor, they never have to be again. And that's really life-changing for a lot of people who need that healthcare. And as a side note, MiraCare actually has 40 plus in-person clinics. So if they see a doctor virtually and the doctor determines they need to be seen in person, they can just go to a local clinic. We have clinics in the north, we have clinics all over the place. So there's the opportunity for them to also go in person.
Wow. Oh, okay. Yeah, it was just a little confusing because let's say if I'm in Sudbury, so I'm seeing someone, but they don't have a doctor, they haven't had a diagnosis, but I've been doing some individual counseling. I can go through this process with them, or I can refer them to this process. That's amazing.
Yeah, as the addiction counselor through this process and OHIP allowable at this point, you can make the referral.
Wow.
And we accept the referral to OHIP for the doctors from addiction counselors. So that's thanks to the province of Ontario allowing us to accept addiction counselors, not diagnosis, but your referral that this person has an addiction or a behavioral process addiction, whatever it may be, as a primary or secondary diagnosis, in your opinion. And that will allow us to get them into this new system.
Right, because I find a lot that's the thing. If I establish with some of my clients, they don't have a doctor. They've been struggling. We've been working on that, but they're just stuck because I can't see a doctor. I don't have one, or even to see a psychiatrist to get their meds changed, anything like that. I mean, it's very common. So neat that I could just, wow, awesome.
Yep, you can just send them our way. There's a short little form that gets filled out, and then they get an appointment usually the same day.
Wow.
And so far it's all been same day with a doctor. The same day they will see a doctor online. If it's determined they need to go into a clinic, they'll call them into the clinic, but otherwise that's how it is. There will be, in a lot of remote and rural communities across Canada, we're currently working on mobile clinics. So the van with the doctor will drive up, he'll go to people's homes, he'll go to community centers, all of those sorts of things. So that is also in process. So no one will be forgotten. There will be access to these new physicians all over the place.
Wow, awesome.
So with that, Crystal, then these clinics are essentially virtual at this point in time?
Right. So right now the clinics are virtual. If the doctor determines that the person needs to be seen in person, say, they're just, coming down from a long cocaine bender or something, and they're feeling their heart race, the doctor may not need to send them to an ER, but may just want to do a quick ECG in office, which all of these offices are equipped with. He might say, why don't you come over? The closest office is here. Let's do a quick scan, that sort of thing. So that'll also enable the emergency rooms to not be overloaded. And MiraCare is fully loaded with everything from x-rays to blood work to, ECGs, EKGs, etc. So lots and lots of good promise. This is the initial test phase for a change to healthcare, to have community-based healthcare and try and pull these more mundane things out of emergency rooms. And by mundane, I don't mean addiction, is mundane. I just mean we don't need to send people to sit in an ER for 9 hours to get their, EKG. So this is a little bit of a test to see how it goes.
Nice.
And we're very, very excited about it.
And are we going to share the where these locations are, or is that?
So it's up to MiraCare because each doctor has a different office, right?
Okay.
So whatever doctor they're assigned, we'll let them, they'll be assigned doctors that are close enough where they can see them based on their geography. So it'll depend on where that doctor is. Remember, we have over 90 physicians on this staff now. So, they're all over the place. We need to let them manage their locations. So the location that everyone needs to know is the info@caccf.ca every time you're sending someone. That's all you really need. Once we get it, then we go through everything, or you'll hear from Abigail or Abby, who's working our intake, and she will get you and your client set up. In the future, so probably around August going into September, as changes continue to come, there will actually be an automated intake process where you can just go in, fill out the form, and it automatically will punch it through for your client to an appointment. But at this point, we're working through the backlog of the manuals.
So many of our clients are without a family doctor. So this should not affect them at all as well.
What do you mean by that? Like,
well, if they don't have a family doctor.
Right. If they don't have a family doctor, they can use our physicians. There's no
Right.
issue whatsoever.
Okay.
That's what we aim for. If someone does have a family doctor and they just don't like them, or they're not able to reach them, they don't qualify under this model because OHIP won't cover a secondary physician. So each Ontarian specifically, because we're starting in Ontario, and next we're in BC, and then Alberta, then Saskatchewan, and onwards. So we're doing this province by province, but in Ontario specifically, you can't have a family doctor on record and get another one. So they have to be without a family physician in order to access the service.
Okay, I see we have a couple of hands here. Now, how do I access?
Good morning.
those
Can I
hands?
ask a question?
Yes, you sure can.
So I can see a lot of clients being very interested in this kind of a model. So would they then be able to maybe de-roster, like if they wanted to, like from their physician that they have?
Yep. They can
And
de-roster.
like if they had a psychiatrist, but maybe perhaps not really seeing the psychiatrist very often, could they then maybe opt to use this model?
Yes. So if they de-roster themselves, they can utilize this model. In psych, they can actually utilize dual psych. OHIP allows that. So they can't utilize dual primary care, like dual family physician, but they can utilize dual psych. So if they're seeing their psych, say, once every 3 months or whatever, their next appointment with their, so they can make an appointment here and start, getting on with the new psych. Their next in-person or next appointment with their current psych, that's when they would de-roster. So psych is a bit different than family physician. They need to have one more changeover, but we walk you guys all through that. We walk the patient through it. We walk the counselor through it. We like the whole connection is done and made. But it's absolutely possible. It's absolutely possible. And it's not complicated on the client's end, right? Our intake is able to handle all of this stuff. So they just have to make the step, like they reach out to their counselor, and then their counselor can send it over to intake.
Okay, thank you.
No problem.
I have a question too.
Yes, ma'am.
Hi, Crystal. One of the things I find is that a lot of the people I meet with, they do not have health cards. They don't have any identification, and getting them the services that they need immediately is very difficult. Would this program here kind of accept them regardless
So
of them having
as
that
per,
health card?
I know
if we were working on it?
I hate giving people this answer because it's not the one I like giving. The problem is Ontario doesn't allow the doctors to bill without the health card number, and the billing is how they function, right? So we can't even book an appointment without a health card number. It doesn't let us. It's not like the system is not set up. I know it's a problem. I know it's a gap in service, but the Ontario system just doesn't let us do it.
What if they have an old health card number and it's expired?
That's fine.
It is, because even in terms of getting medications, they'll need their health card, right?
Absolutely,
So,
because a lot of them will be controlled substances, right? So an expired health card is fine. Even if they find on an old piece of paper what they think the number was, if it runs through, the way that the system works is the province allows us to run through the health card prior to the appointment, like as a booking of the appointment, it runs the health card and we get a flash. It's either valid or not valid. If it's not valid, what that means is that it's the wrong number or the number just completely doesn't exist. Anyone that's expired in the system currently and for the next year, while we make all these changes to the healthcare system overall, anyone who's ever had a health card and they have the number will come up as valid.
Okay,
So
that's
even if
good.
they just find a piece of paper that says what their number used to be, it's still going to be valid for these purposes.
Oh, that's fantastic news. Okay, thanks so much.
No problem.
Can I ask a question?
Yes, of course.
You know, we spoke about how clients don't want to tell their story yet again. Is the therapy short-term, long-term? Is there any limit on it?
So as long as they have a valid health card, the access to these physicians will be lifelong. So there's no requirement for them to switch psych again. There's no requirement for them to, you know, if they need an ADHD doctor or they need a cardiologist, they do not have to leave these physicians and tell their story again. The whole point of this new model that we're testing out in Ontario, which is a best practice in lots of other places, is to make sure that the continuum of care continues forward so that they don't have to keep telling their story, so that forever MiraCare will be able to carry them forward regardless of where they go in the province. So that's also a super exciting way, because what if they want to move? They've got to start all over, look for a new doctor, tell their story. That will not happen again. This is the new model Ontario is moving towards. We are testing it, and we believe it'll be successful in that way. In regards to telling their story, you can also, as a counselor, have the opportunity to brief the physicians. So there are the opportunity for you to have a brief with the psych or with any of the other physicians about your concerns. Your case notes go to intake, or you don't have to send all your case notes, but you can send a brief to intake with your referral if you choose, or you can ask intake to make sure that you have opportunity to brief the physician prior to the appointment. So there's also that opportunity for continuum of care. We really want to make this easier on Ontarians. And one of the, and of course, across Canada as we move the model forward. But it will look a bit different in every province because the healthcare system is a little bit different in each province. So, but Ontario is for sure going forward. So, yep, continuum of care is the whole reason we started this, and the whole, you know, the whole concern we had.
Great, thank you.
You're welcome. If you have a question, you can just speak up. I can't see all the hands that were up. They're just kind of like gone. But you can just ask a question and we're happy to answer it.
I have another question.
Yeah, go ahead.
Shelley. When will this get started officially? Like
It is officially started now. We've
Okay.
done several dozen intakes already and they've all gone mostly smooth. A couple of tech issues, but yeah, it's open and moving now. We're doing it manually because again, we're working through making sure we have the best system set up through the OAT system and through Mira and CACCF combined. And so it is open now. You could make an intake right this second and it'll get, you'll hear from Abby, who's basically, you know, a 24/7 person. So you'll hear from her pretty quick.
Excellent. All right. And so we just email you at info@CACCF
Yeah, for now.
asking
There
for the
will be-
referral. Yeah.
Yeah, there will be an automated system. We're still working through that relationship with OHIP of how to, you know, make it as easy as possible on you guys as referrers. But right now we'll do all the manual work. You just give us the info, and always ask your client if they're available for an appointment on the day that you give us the info, because it's almost always same day for the first appointment. We try and get them in,
Okay.
get their appointment in, and go from there.
All right, thanks so much, Crystal. And I know you've helped me a lot in the past with all my little technical concerns. So thank
You're
you.
wonderful. No problem. This will be easy, I promise. Someone
Okay.
actually asked in the chat, does the client have to be assessed by a medical practitioner to be accepted? No. If you, there's no need for that whatsoever. The system is set up so that you, as the addiction counselor, can say, I think this person needs medical attention, or I think this person has a need to see a specialist of any kind, or needs to be assessed for something else. It's not asking you to make the diagnosis. The system is asking you to say, I think there's an issue, and that will accept your referral through the system. So this is a big change coming. And so right now, as we test it, you will continue to do that. Your referral is enough for the system and for OHIP to accept it at this point. And so you will be able to send them to us without question. It is you that we depend on, because you know your clients better than we do. You know what they need. You know what they're telling you that they need. So the province is trusting you to say, this person needs care. And it will be out of your scope. You can't diagnose them with ADHD or diagnose them with something else. But like Sandra said in the chat, you see your clients more than any other healthcare provider. And in Ontario, you currently are not regulated, but you are a healthcare provider. And that's changing too, right? They're going to start to recognize that. And this is a big part of that change coming. So.
Hi, just one other question as well. I'm not sure if you mentioned this, but can clients self-refer?
So clients can self-refer. You can give them the email and say you can email them, and Miss Abby will reply back to them and help them out. You don't have to do the paperwork for them. You don't have to do any of that. You can just give them the email address for now and say, here's where you email, tell them you need a family doctor, and off they go. And Miss Abby will take care of them from there. When the system is automated, it'll just be a link where they just go and click, 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 and it'll be done. But again, we're still working through that relationship to make sure OHIP transfers properly. But yeah, you can just hand them that email. You can give that email to anyone in Ontario. You can give it to your friends, your colleagues, your counselors. If that person knows someone or is someone who has a primary or secondary, in your opinion, addiction, then they will be covered under this program under your referral. They do need to give us your name as an addiction counselor, because your referral name has to be on this in order for OHIP to cover it. So we need the name of the counselor. You always have to make sure we have the name of the counselor, because it will make sure that we have someone to tie this client back to, especially once we move into case conference.
Okay, thank you.
Are there any other questions, or are we reclaiming time in our day?
I think we are. That was a long and incredible first day, that's for sure.
Yeah, everyone did a great job. I'm so grateful that y'all are here. That was my Yankee coming out in me, I'm sorry. I try and keep it Canadian. Okay, thank you everyone. Jim, thank you as one of our first medical providers. We're grateful for you and all of your experience that you have given to our clients thus far, and CACCF in general. So we appreciate you leading this session, and all of you for being here. You get to reclaim 20 minutes of your day, go for a run, have a snack, go see the sunshine. And if you need us,
breakfast.
Yeah, have breakfast. If you need us, you know where to find us.
All right. Thanks, everybody.
Have a great day.